phase to fully benefit from cash programs. The second part of the session will be the occasion for all of you to ask questions to the speakers or to make any comment based on your experiences. So feel free to contribute from the floor. But throughout the presentation of the speakers, we encourage you to post any questions that you may have on the chat box, and we will be making a selection of those depending on the time that we have. So we have the honor today also of having with us Karen Peachy, Director of CALP, and Gordon Rattray from the European Disability Forum, who will be making the closing remarks. So now, without further ado, and to kick us off, I am now inviting Julie Gerald-Lufsen, Cash-Based Intervention Support Officer at IOM HQ in Geneva, to set the scene by sharing with us why it is important to mainstream disability inclusion in cash-based interventions and IOM efforts on disability inclusive cash programming. Julie, the floor is now all yours.
Thank you, and thank you for inviting IOM to give a short presentation at this important session. And firstly, good morning and good afternoon to everyone who are participating. Cash assistance is considered a timely, responsive, and flexible humanitarian response modality that can give affected populations freedom to prioritize and choose commodities and services based on their own unique needs. This means that the cash modality is seen to deliver assistance that is more dignified and able to restore feelings of choice and empowerment in the recipients. At least 15% of any disaster-affected population will be persons living with disabilities. In humanitarian crises, an increase in this prevalence is often observed. For instance, in Syria, the Disability Prevalence and Impact Survey from 2020 found that 30% of the affected population had a disability. The rights and needs of persons with disabilities are often overlooked in humanitarian response. While there is an increasing demand from humanitarian stakeholders to take greater account of inclusion issues, there is still an incomplete understanding of the role that cash-based assistance may play, both in the protection and empowerment of persons with disabilities, and the risk and barriers that persons with disabilities may face when they access and use cash in these settings. For instance, very few cash interventions conduct assessments that include persons with disabilities to better understand contextualized barriers, which means that few interventions are accessible physically and communication-wise, and there is a gap in our understanding of how stigma may play a role in excluding persons with disabilities from cash assistance. In addition, intersectionality with gender, age, religion, race, ethnicity, among others, can also exacerbate vulnerabilities to protection concerns. We welcome the Interagency Standing Committee guidelines on disability inclusion in humanitarian action and the solid place given to cash-based interventions in a document. However, there is still a large evidence gap in our understanding of the role of cash assistance and the effectiveness of disability inclusive practices in cash transfer programming. To avoid leaving persons with disabilities behind, it is important to mainstream disability inclusion in cash assistance programs in all phases of the project management cycle, using a participatory approach where persons with disabilities and their representative groups are at the heart of the work. To improve humanitarian programming and mainstream disability inclusion, it is vital to gain a better understanding of the prevalence of persons with disabilities, their needs, preferences, and capacities, and the barriers that they face when accessing and using cash. IOM has implemented cash-based interventions for many years, and we renewed our focus on disability inclusion within cash and voucher assistance programs in the last few years, as stated in the IOM strategy for humanitarian cash-based interventions, 2019 to 2021. This year, we've taken our commitment to disability inclusion further with a recent memorandum of understanding with CBM Global, under which we hope to generate evidence and promote innovative practices through our collaboration on disability inclusive cash assistance. Since 2018, we've paid specific attention to mainstream disability inclusion in operational tools and guidance for staff members, among other things, to strengthen the considerations of persons with disabilities when writing proposals, conducting post-distribution monitoring, and planning cash for work interventions. In Afghanistan, IOM's protection program is working with some of the most vulnerable undocumented returnees, including persons with disabilities. This includes assessment of the affected population's needs and abilities, as well as adaptation of the provision of assistance based on the specific needs of persons with disabilities, and cash for protection to mitigate identified protection risks. In Cox's Bazar, Bangladesh, persons with disabilities have been included in cash for work interventions, which have resulted in key benefits, including a positive change among local community members in their perception of persons with disabilities, while persons with disabilities have been able to earn an income and felt welcome and included. In South Sudan, we've piloted CBM Global's inclusive humanitarian cash transfer tools to better understand the situation of persons with disabilities as recipients of cash transfers and how disability inclusion can be mainstreamed in cash programming, with the aim to contribute towards joint learning in the area of disability inclusive cash assistance. In the coming years, we aim to strengthen the inclusion of persons with disabilities within humanitarian cash responses even further by addressing the existing evidence gaps by gathering evidence on persons with disabilities and learnings on disability inclusive cash assistance, while also strengthening our organizational capacity for disability inclusive programming. This will only be achieved in cooperation with and through greater participation and involvement of persons with disabilities themselves and their representative organizations in the countries where we intervene. Through these interventions, we hope to contribute to the collective efforts of the humanitarian community in generating knowledge and evidence around inclusive cash-based interventions, and we welcome CBM Global's initiative at this HNPW event, as well as the other initiatives that the expert will present during the session. Thank you, and we look forward to a fruitful session.
Great, many thanks, Julie, for your insights to help us set the scene of this session. It is really good to hear how IM is now looking at disability inclusion in cash-based interventions, and great to hear that you've touched on important topics that now our three experts will be talking us through. So I'm gonna now hand over to Cucu Saida. She is a disability rights activist and a disability inclusion advisor in Indonesia, providing technical assistance to both development and humanitarian actors in Indonesia. She will talk us through the importance of data and disability and how disability must be considered in needs assessments, identification and targeting in cash-based humanitarian assistance. So Cucu, I'm going to hand over now to you. And just to clarify to the audience, there will be some slides this time from Cucu herself. Thank you, Cucu. The floor is yours.
Thank you, Christian. Hi, experience from Indonesia on cash assistance. So I'd like to start with the talking about the about the situations of persons with disabilities in humanitarian settings, which I believe that we are all already aware of. But I'd like to kind of remind again what are the situations of persons with disabilities in humanitarians and why. For example, today we are talking about the importance of disability inclusive in cash assistance. So one of the things is that, first of all, of course, that's persons with disabilities is far more disadvantaged in humanitarian response. Although lots of humanitarian actors who are working on the cash assistance, even from the government, for example, but still persons with disabilities are in the risk of far behind or does not receive the assistance. So the second thing is medical access that existing like in the countries, I think wherever we are, like in Indonesia, that this one exaggerated in the event of disaster, and then this of course that's the risk of increase the number of persons living with disabilities. So, for example, the inaccessible or barriers in physical, I mean, in the buildings, things like that. For example, like providers or finance providers. That's also we need to consider about when we talk about the cash assistance program. The other thing is that I'd like to connect it with the current situation with COVID-19, which is adding to the risk for people, for persons with disabilities, which they are all mostly like earning income for the informal sectors, like selling something on the street or on the market. And because of the COVID, is then lots of people, persons with disabilities, loss of their incomes. As we were supported OPD's network in Indonesia, and one of the results, it's quite significant that COVID is really impacted to the life of persons with disabilities. And then the fourth one is it is about the kind of the intersectionality about women with disabilities are again is in the highly risk and neglected in the responses, especially for women with disabilities who are also like who have this single income in the household, for example, or women with disabilities who has children, things like that. So there are face more risk on neglected in the responses. And then the fifth thing is the problem on data. I think this one we are all agreed that everybody always talk about the data of persons with disabilities and the system. So whenever we had the discussion with the network, always where are they? So that's a big questions on that. So to the next slide, please. Yeah, I'm talking about the examples of the barriers that's facing by persons with disabilities in needs assessment and targeting. Is that I'd like to start with the stigma or negative attitudes as a roots of everything of the, I mean, to the breakdowns of the list. That's because of the stigma, because of the negative attitudes, then it is a fact too that one of the thing persons with disabilities does not counted or included in the family card. For example, in Indonesia, each of households we must have a family card which consists of all the family members, but because of something like if you have children with disabilities or member with disabilities is kind of the same of things like that. So many of them are, prefer not to include the name in the family card. And then the next problem, what also we identified from the experience when we did the needs assessment, is also about the lack of having the national identity cards, which these two things make persons with disabilities are ineligible or not eligible for any cash assistance, either from the governments or from the other humanitarian actors. And then next thing is for persons with intellectual disability and psychosocial disabilities, they are more neglected on it. And then again, about the incomplete government data. This
We seem to be having some connection issues with Chuchu. Let's see if connectivity comes back. Okay, so what I suggest then, really sorry for this connection issue with the sound, with Cucu joining from Indonesia. What I suggest then is that we move then to the next presenter, and then we'll ask in the Q&A session Cucu, if she's back with us, to respond to some of the issues that she's raising. So on that note, then I'm going to hand over now to Daniel Montt. He is the Director of Inclusive Policy. And as a researcher from the field of inclusive policy and social protection, he will take us through the evidence of extra cost of living with disability and its relevance for cash-based humanitarian assistance. So Daniel, I'm going to hand over to you now. The floor is yours. Thank you.
Hello, everyone. I'm very happy to be here. So we need to think about disability extra costs because when we're giving assistance to people with and without disabilities, we have to keep in mind that people with disabilities have these extra costs of living. So giving them the same amount of assistance really is not having the same effect. And there are two types of costs with disability. The first are indirect costs, which are the cost of exclusion. So foregone income of people with disabilities and their family members because they have because they're not able to work. And during humanitarian times, this could increase because the support system that might enable someone with disability to be independent could break down, and therefore it increases the responsibilities of family members and as well. And so the costs of foregone income could increase. And the second type of costs are the direct costs. And these are the extra expenditures on goods and services that are needed. And they could be extra costs on general expenditures, with things that everyone spends money on, for example, healthcare or transportation or even shelter. But there's also extra costs on disability-specific things like assistive devices, sign language interpretation, and things like that. Next slide. And when we're looking at these extra costs, there's really two ways of thinking about them. One is looking at the actual expenditures people make. So going in and saying, okay, here's a family with a disability, here's another family who doesn't have a person with a disability in it. What are the differences in their expenditures? But a better way to think of it is the expenditures needed for full participation. Like, what does that person with a disability need to spend on so they have equal participation with others? And the reason why these two things might differ, well, maybe they don't know about assistive technology or other supports that they could purchase. Maybe they're not available, which of course could be more of the case during a humanitarian issue. Maybe they're income constrained, so they need to spend money on assistive technology, but they don't have the money to spend on it. There could be discrimination in the household. The family may decide, well, we don't want to spend our money on this person. And there could be other barriers to participation as well. Next slide. Next slide, please. Can we move to the next slide? There we go. So the variance in these expenditures is quite large. Sometimes that variance could be because of the different type of disability. And this data is from South Africa. So you can see that on average, blind persons tend to have a lower expenditure than, say, persons with deaf blindness. But you also see a huge amount of variance within a type of disability. So the blue bar was the lowest level of extra expenditures found in the sample, whereas the orange bars were the highest level. So you can see there's a huge difference. That difference could be because of the different barriers they face. It could be because of the degree of disability, but it's also due to whether the people are participating or not. So a deafblind person who is staying at home and not leaving and is just sort of trapped there doesn't actually have very many extra expenditures. Right? Their family, they have to eat and that's it. They're just standing there. But if they want to participate, if they want to go to school, if they want to go to work, if they want to attend civic activities, then they need a guide interpreter. And that can be very, very expensive. So those extra costs, if you look at actual expenditures, you might find low costs, but that doesn't mean that you're really covering what the people need in order to to fully participate in society. Next slide. And we can kind of see this with this data. This data comes from a country, it's not published yet, so I don't have the name of the country, but it's from the Middle East region. And you can see that when we estimate those extra expenditures that people are making, this is not the extra expenditures they need, but the extra expenditures they're actually making. And we divide it by income quartile. You can see that the highest expenditures are in the lowest quartile. Now, why is that? Because that's 31.8% of the average income of the lowest quartile. And those are probably the minimum basic needs that people with disabilities need to survive, you know, so those at basic level. Now, when you get to the second lowest quartile, you see it goes down to 13.4, but that's 13.4% of the average income in that quartile. So the actual money that's being spent is really about the same. But as that income goes up, you can see the percentage goes up. And it's not just the percentage, remember, it's the percentage of the average income in that quartile. So it's the highest quartile, what has the highest income, where 23.6% of the average income in that quartile seems to be what is needed for full participation, thinking that people who are the richest are spending everything that they need. So the data show, and this data is similar to what goes on in other countries too. We see the highest average expenditures in the lowest quartile and in the highest. So the highest quartile is probably the closest to full participation. The next slide. And in a humanitarian context, I think we have other factors which could be affecting these costs. First is the impact of the crisis on infrastructure may create additional barriers, right? In order for people to participate, they need to overcome barriers, and if there is damage, whether it's physical damage because of floods or earthquakes, or whether it's because of damage to infrastructure from conflict or whatever it is, that could actually increase the extra costs of people with disabilities, because they now have to overcome barriers that weren't there before, and therefore they need more money in order to overcome them. The second, there could be an impact on the supply chain for goods and services, which could impact the availability of say, assistive technology or sign language interpretation or medical care or whatever it is. And therefore, you could see actual expenditures going down, not because they don't need them, but because they don't actually even have the ability to spend them on the things they need. And conversely, it could go the other way in the sense that if supply chains are disrupted, the price of goods and services that people with disabilities need might actually increase. Third, another reason why the humanitarian context could affect the extra cost of disability is they might need to replace previously purchased items that are lost, damaged, or left behind. And this could also mean not just in items like, say, a wheelchair or something like that, but it could also be something in their home, because a lot of homes have a lot of people with disabilities will make modifications to their home and to allow for increased accessibility within the home, and those too could be damaged. And finally, there's a changing participation landscape. Okay, remember, what we want is not the money just to keep people with disabilities alive. We want them to have the ability to participate on an equal basis with their non-disabled peers. But that participation landscape could change. It could be that there isn't opportunities to participate because things have broken down, or it could be that there are increased barriers to that participation. So it's very important to realize the extent of these extra costs. They're very significant, and that they're spent on regular items and disability-specific items. And we need to not just be providing people with assistance to keep them alive. We need to be providing assistance so that they can have an equal chance at life as people without disabilities. So try to keep that very short, and hopefully, if people have questions or comments, I'd be very happy to discuss them with you. Thanks.
Thank you very much, Daniel, for your very insightful presentation. Actually, there was one question in the chat box, and I'm sure that other participants may have a similar question. The meaning of quartile. So maybe, Stephanie, if you can just move back to the slide where Daniel was talking about that, and if you can just clarify so people understand exactly what you meant.
So the lowest quartile, those are the people in the bottom 25% of the income distribution, right? So if you line everybody up from the poorest person to the richest person, right? And you look at the people who are in that bottom 25%, okay? In that bottom 25%, the extra costs of disability are about 32% of the average income of those poorest people. So among poor people, they need to spend about 31.8% of their income on the extra costs of disability. See, in the highest quartile, they're only spending 23.6%, but those are the richest 25% of the people. So the average income among those richest people is much higher. So 23.6% of the average income of the 1/4 richest people is going to be a lot more money than the 32% of average income among the poorest people. So you can see that among the poorest people, it's taking a bigger chunk out of what they have, but they're spending less. Why? Because they don't have the money to spend what's really needed. Whereas the richest people, okay, are spending less as a percentage of their income, but the actual money they're spending is actually more because they can afford to buy everything which is actually needed for people with disabilities.
Great, thank you very much, Daniel. So I hope that that clarifies the question. And if you still have some questions, then let's use the Q&A session to address those. Thanks again, Daniel. So I'm gonna move back again to Chuchu, just to check, Chuchu, that you're back online with us and see if you can proceed with your presentation. Chuchu, can you hear us? Hello, yeah. Chuchu. Yes, okay. Yes. Great to have you back.
Sorry, everyone. Yes, sorry, just the connection just dropped. So thank you. I'm glad that back to this session. I only have 2 more slides on here. That's I'd like to share about what would be the points or perhaps that a good practice for inclusive needs assessment and targeting. Christian, maybe we can move to the next slides. Yes. So first of all, I'd like to really highlight about the importance of working or collaboration with organizations of persons with disabilities or individual from disability movement. It is very important. It is not just because of the principle of working on disability inclusion as in the convention says, but working with them is that because of the reality that lack of data and information on where are people with disabilities or persons with disabilities in the local community, for example. So when you are working with the OPDs or organization of persons with disabilities, they have the network throughout the areas, and then they will show you or at least they will inform you where to go in regards of the existence of persons living with disabilities. And then the second thing, what I highlighted is the importance of the technical assistance for inclusive humanitarian response. This is the work of how we really need to influence all the time of the humanitarian response or humanitarian actors, yeah, because then without influencing, without technical assistance, sometimes then, for example, after they got training and then they will forget or even like confuse how to do. But giving the technical assistance or even just sharing how to do, it is lots more helpful or useful to make the humanitarian actors understand and start to input into the program on the cash assistance, for example. And the third thing is that surveys through the households to identify persons with disabilities. This is also that's we highlighted that it's very important. And again, we need to avoid about the classifying disability person with disability as impairments, because then we won't have the valid data on that. And the last one, use of Washington Group questions. I guess Dan is very, expert on this. But it is important to try to start to use these Washington Group questions in this setting. Although in the reality, in the practice, especially when we have a new partner, for example, in the humanitarian actors who wants to start with the disability inclusion in cash assistance, sometimes they bit confused or sometimes a bit resistant on that because of the system, for example. But we need to working tirelessly to really encourage them to use this instrument. And last slide, please. Yeah. About the this is the more experience of CBM country office in Indonesia working on the cash assistance. What we did in the response is that we had work or formed the age, disability, and focal points in the area of disaster affected. This was the response in Central Sulawesi, where at that time we include member of persons with disabilities. We work, we do partners with organization of persons with disabilities, and also include the volunteers with disabilities. They are all together to do the household survey, for example, to identify persons with disabilities. And then the second, our experience from the recent disaster in West Sulawesi. It was the support the development of disability inclusion humanitarian volunteers. So in Indonesia, the disability activists, they are now more and more aware and working voluntarily in the disaster response, for example. So it is so our experience that's work with them in this response also quite it's really useful on identifying persons with disabilities to be as a recipient or as the program participants. And the last one, this was the experience of having the related between the earthquake and COVID response, both in Central Sulawesi and Jogja. That's we were working or in partners with the humanitarian actors and the organizations of persons with disabilities. So this not summary, but the what are the highlights from this is that really when we are working on the disability inclusive on cash assistance, for example, it is very important to work with organization of persons with disabilities or from the disability movement. That is to make sure from the beginning, from the process, from the not only identifying people with disabilities, but also identifying even including the what will be the extra costs on disability, things like that, and then the understanding of the barriers itself, those kind of the thing that's they are really understand on that. I guess I would stop here to open that later on the discussion, and thank you. Over to you, Chris.
Great, thank you very much, Chuchu. I'm very glad that you managed to go through all your presentation. It was loud and clear. And very good to see that both you and Daniel have already addressed what we know are the must-do actions in any humanitarian intervention, which is to look really closely at data to inform the response, the participation of persons with disabilities and their representative organizations in programs, and and the importance of capacity building of persons with disabilities as well in any response. So thanks a lot, Chuchu. So now I'm going to hand over now to Manuel Roth, who is a cash expert from CBM Global, and he will take us through learning from CBM Global humanitarian responses as a way of closing these round of interventions. Thank you, Manuel. Over to you now.
Thank you, Christian, and hello, everyone. I'm very happy to be here and share with you some findings from a recent study that we have conducted of our cash programming in humanitarian settings across different countries and different years. So CBM started using cash as an aid modality in humanitarian response in 2014. And last year, we have conducted an assessment, or rather quite an in-depth study of different cash responses in the countries you can see here on this map, which are Zimbabwe, Burkina Faso, Niger, Pakistan, Bangladesh, Philippines, and Indonesia. So across quite different risk contexts, we documented several cash interventions. In some countries, there were recurring or several interventions over time. In some countries, there was only one. We documented these in detail as case studies, talking to the field staff, talking to people, also visiting some of the context when it was still possible, and doing research or analyzing all the available secondary data, and then comparing these case studies across to see, what worked, what were some patterns, what were good practices. In total, it was 12 cash interventions which were documented, of which 10 were unrestricted, so multi-purpose cash assistance provided quite immediately after a disaster. So let's go to the next slide. I will share with you just some of the findings, some of the highlights I find. There's much more to say, but to keep it short, I will limit it to some of the findings. And I will go through the cash programming cycle and share some of the findings for each of the steps of implementing a cash assistance program. So starting with assessment and analysis. So as Chuchu has already mentioned, the Washington Group questions, we have seen across all these responses that these 6 questions, or now with the enhanced set, it's more than 6, but in most of the responses, 6 questions have been used. So do you have trouble seeing? Do you have trouble hearing? And these have been used quite consistently across many responses in all of the assessments, so needs assessments, but then also in the post-distribution monitoring, and have helped a lot to disaggregate and analyze the data that comes out of these assessments later on, and really make sure that we have a clear understanding of the situation and needs of different groups of people with different functional limitations. So this has been a very helpful tool that has been used across different responses. Example, the Bangladesh Cyclone Amphan response, which very consistently used the Washington Group questions, starting from the rapid needs assessment to really determine the needs of different groups of people. Then a second finding was that considering barriers to cash access, so all cash distribution mechanisms come with some barriers. There's no perfect distribution mechanisms for all people with all different types of disabilities. But the important thing that we found across all these responses was that it needs to be integrated, considered in cash relevant assessments to be able to identify the most accessible, or let's say the least inaccessible delivery mechanism, and also ensure that barriers can be anticipated and then overcome as part of the cash programming. And there's two types of assessment that were used in several of the responses. One was an assessment directly, with people with disabilities from the affected communities, assessing their practices and preferences of managing cash. So this was part of the feasibility assessment for different cash programs. And then secondly, considering environmental and institutional barriers when assessing available delivery mechanisms. So part of the financial service provider assessment in some of the responses included specific questions on environmental, so physical barriers, but also the institutional, more the processes, maybe legal barriers that would come with certain electronic cash transfer mechanisms. These were conducted, for example, in Burkina Faso or in Indonesia, and have resulted in Indonesia, as an example, in a change of the delivery mechanisms from one response to the other. So it was conducted at the beginning of the second response, and then the delivery mechanism was changed from a bank transfer to a transfer to the post office in Indonesia. In Burkina Faso, it has led to the conclusion that mobile transfer would actually be the most accessible transfer mechanisms for people in an urban area where a program is being implemented. Let's go to the next slide. Then next step, identification and targeting, what Chuchu has already mentioned. So we have also seen quite consistently across all the responses how difficult it is to identify persons with disabilities who remain hidden in the data. So the strategy that we mostly used was to triangulate data, use data from different sources, as Chuchu has already mentioned. So not only relying on government data, for example, from local social protection authorities, but also from local organizations of persons with disabilities, and then doing household surveys to complement that data. And most often what we have done, because it needs to go fast in humanitarian settings, is a kind of a snowballing household survey where we would move through the community quite fast and try to identify as many persons with disabilities as possible. Then a second finding, which might be sometimes overlooked, is that persons with disabilities, they should have the possibility to register themselves. So be the direct beneficiary of a cash transfer, and not we have to go beyond the assumption that a person with disability will always be a dependent in the household and will have to need someone else register as the direct recipient. So we have some data from post-distribution monitoring, but also from needs assessment, where really the large majority of persons with disability say that, yes, they would like to be able to be the direct recipient and manage the cash themselves, and they would rather not have a caregiver or a family member having to access the cash for them. So in most of the CBM programming, it's really that if a person with a disability, if a household with a person with disability, if the person with disability wants to be the primary recipient of the cash transfer, we want to make this possible. And then the last point is that the data that comes out of the identification and targeting processes in almost all of the responses was then shared with the local authorities with the consent of the people whose data that was collected, to be able to create this link of the people that were not registered with the government and remained hidden in the community, that they get access to social protection mechanisms. Thank you. Then the next step is enabling the access to the actual cash distribution and to using the cash in the markets. So what we have seen is in the cases where we had e-transfers, so either mobile transfers or bank transfers, some individual support for registration and account setup was needed. But this was always quite a low number of cases. So in an example in Bangladesh, it was actually less than 0.1% of people who during the registration said, we need additional support to make sure that we can set up our mobile accounts. We had a similar number in Zimbabwe. It was a very low number. In Indonesia, it was a little bit higher for bank transfers. So to register people with a proper bank account took a little bit more of a legal process, and there were more people requesting direct support, which was then provided by the field staff. Then a second point, which I find very interesting, and this is an example from the ongoing cash transfer response to COVID-19 in Bangladesh, is the collaboration with local vendors, so local shopkeepers, to improve the accessibility to market. So some of the shopkeepers in an urban area, for example, agreed to deliver goods directly to the home of people with disabilities, and thus improving access. There's also some shopkeepers who are interested and starting to make their own shops a bit more accessible. And I do think that cash transfer programs can be an opportunity to improve the accessibility of local markets. And there's also an incentive for local vendors to collaborate here. So I think that's a very innovative example. And then the last point for the post-distribution monitoring, we have seen that across the responses, there was collaboration with local organizations and persons with disabilities. And I do think that's key to make sure to really capture the voice of persons with disabilities in these PDM surveys, because it can easily happen that field staff will have difficulty communicating directly with persons with disabilities and will start talking to caregivers. So this was an example that came out of Indonesia in the debrief after the PDM survey, that this was a kind of almost a systematic challenge for the field staff. So in other contexts, like for example, in Burkina Faso, we have worked directly with organizations of persons with disabilities that they would implement the PDM survey together with the implementing partner, who was a local NGO. Then let's move to the last slide, which is coming back to what Daniel introduced, the accounting for extra cost. So we don't have very robust data. But there were some responses where this extra cost within the humanitarian setting was assessed. So there is across the responses and the field teams, there was an acknowledgement that there are disability-related extra costs, which will require persons with disabilities to invest more to reach the same level of basic needs coverage, even in a humanitarian setting. And these are costs for medicine, treatment, diet, hygiene items, but also transport, for example, transport to the market, or the repair of assistive devices, which allows the access to cash transfer and to market in the first place. So we have two responses where this was estimated, this cost. In one response, a survey was conducted that was in Indonesia, but it was quite inconclusive. It was difficult for people to estimate what the extra cost is. And then we have another example, which is from Bangladesh, where in consultation with organizations of persons with disabilities, this cost was estimated. And it was then estimated at 20%. So needing 20% higher multi-purpose cash assistance to receive the same outcome in terms of basic needs coverage. Now, this is a bit lower from the number that I've seen now in Daniel's presentation, the 32%. So that's very interesting. And I think as humanitarians, we need to invest a bit more to come up with fast and reliable tools and mechanisms for gap analysis to consider these extra costs in humanitarian settings. We have also one response where then a top-up amount was provided. That was also in Bangladesh. That was the Cyclone Amphan response, where we have some data where 20% higher multi-purpose cash assistance was provided to households with persons with disabilities than in addition to the regular cash transfer, which was based on the calculation of minimum expenditure basket. So the top up was 20% plus. So I'll stop here. Let's go to the next slide. So these have been some highlights. Now there's an upcoming publication on this study, which will go into much more details and also have further insights. And we're expecting this to be published and launched in June 2021. So in about a month and a half. And it will also be available on the CBM website of CBM Global.
Okay, thank you very much, Manuel. Very insightful and thorough presentation. Thank you. And Hossein, I see you were asking about the publication, so I think your question has now been answered. So thanks very much to the three presenters. So now let's move on to the Q&A session and debate session. I mean, we want this obviously to be, a free flow. So please feel free to raise any questions. But before doing that, I'm going to ask Nasima Akhtar, who is the director of the National Council for Disabled Women of Bangladesh, to provide a first reaction, any comments or inputs that you have. So Nasima, I'm going to hand over to you. And I know that you have someone that will help you translate if you're not comfortable with English. So over to you now. Yeah, Nasima, can you hear us? Okay, so while we see if she can connect.
Yeah, Nasima is connecting. Just give her a moment. Yeah.
Okay. Over to you.
Hello, everyone.
Hello, Nasima. Please go ahead.
Yeah. She is a Bangla. Translate to Reza Bhai.
Okay, I will take the
cash transfer experience.
Hold on.
প্রথমে আসলে আমরা যে কাজটা করছি সেটা হচ্ছে যে সিচুয়েশনে আমরা প্রথমে আসলে আপনার হচ্ছে যে প্রতিবন্ধী ব্যক্তি এবং অপ্রতিবন্ধী ব্যক্তিদের মধ্যে আইডেন্টিফাই করছি এবং তারপরে আমরা ক্যাশ ট্রান্সফারটা তাদের মধ্যে আসলে করা হয়েছে এবং সেক্ষেত্রে আমাদের এক্সপেরিয়েন্সটা হচ্ছে একেবারে নিউ। যেখানে আমরা আসলে কাজ করি প্রতিবন্ধী মানুষদের নিয়ে, আমাদের এই প্রজেক্টটাতে ছিল যে অপ্রতিবন্ধী মানুষদের একটা ইনক্লুশনের ব্যাপার ছিল এই প্রজেক্টের কাজের ক্ষেত্রে। ভাই তোমার আমি বাকিটা বলি।
What she says that this was a new experience for us, and in this particular COVID-19 situation, we addressed both the persons with disabilities and persons without disabilities. So we conduct the assessment, household assessment, to find out the persons with disabilities and persons without disabilities who are eligible for the transfer. Apa tarpor bolen. Nasima apa? Nasima apa?
Yeah, you need to unmute yourself. Yeah.
জি জি। সেক্ষেত্রে আসলে আমরা প্রজেক্টটাতে কাজ করতে যে আমরা দেখছি যে আসলে প্রতিবন্ধী মানুষদের জন্য ক্যাশ ট্রান্সফারের পাশাপাশি আসলে তাদের জন্য বিশেষ করে আপনার অ্যাসিস্টিভ ডিভাইস রিপেয়ার করা, তারপরে ট্রান্সপোর্ট সাপোর্ট একটা প্রতিবন্ধী মানুষদের জন্য বড় ধরনের একটা বেরিয়ার। এই জায়গাগুলোতে যদি একটু সাপোর্টের তো সেক্ষেত্রে আসলে আমরা আমাদের আসলে প্রতিবন্ধী মানুষের আরো বেশি আসলে প্রতিবন্ধী মানুষদের নানান রকম বেরিয়ার আছে বাংলাদেশে, সেটা একটা বিষয়। আরেকটা হচ্ছে যে আমরা যখন আসলে কাজ করছি সেই কাজের অভিজ্ঞতা থেকে দেখছি যে আসলে প্রতিবন্ধী মানুষদের জন্য যেহেতু ইনক্লুসিভ প্রজেক্টটা ছিল, মানুষের দৃষ্টিভঙ্গি পরিবর্তন করাও একটা এই প্রজেক্টের জন্য ভালো দিক ছিল। সে জায়গা থেকে আমাদের সিবিএম সিডিডির সাথে ভালো কোলাবোরেশন ছিল তো সেই ক্ষেত্রে সব মিলিয়ে আমার কাছে মনে হয়েছে যে আপনার হয়েছে যে এই বিষয়গুলোতে যদি আরো বেশি একটু নজর দেওয়া যায়, তো সেক্ষেত্রে আমরা আরো কাজ করতে পারতাম।
Okay, what she says that
আপনি বাকিতে যোগ দিয়ে দিয়েন ভাই।
আচ্ছা, okay, what she says that for persons with disabilities, some of there are some additional issues that we need to consider, because they need assistive devices, they need additional transportation costs, and they also require medication sometimes. So for that reason, they need additional support. It is not that for this project, we have identified few persons who actually receive this additional support, but from her point of view, many of the persons with disabilities actually require that support. So maybe we can consider to provide this additional support to more beneficiary, more persons with disabilities in the future. And also she said that this type of activity actually, when we collaboratively implemented in the location jointly with CDD and CBM, so there was some requirement of sensitization, because there are negative attitude in the community, and for that reason we have worked a lot, but we need to work some more to make the project more effective.
Okay, thank you very much, Nasima and Rizul. Just in the interest of time, I would like to hand over also to our colleagues and participants to ask any questions. So thanks a lot for your insights, and it's good that it comes already from an organization of persons with disabilities that has benefited from cash programs. Thank you. Tushar, are there any particular questions from the chat box for our speakers?
Hi, Christian. Well, thanks, and thanks to all the panelists. Indeed, it has generated some interesting questions. We are running slightly behind schedule, so I'll try to club some questions and pose it to the panelists. Maybe just looking at some of the questions that have come across around identification and targeting. So there is a question from Stefan IRC. He says, I'm most interested how to identify people with disabilities as part of large cash program. As we typically target households in such programs, people with disabilities might not be easily visible or identifiable. Do you think recruiting age and disability focal points from the community who may have a disability and no others, and then snowball, is a good option? So Chuchu, I may just throw this question to you if you want to address it. Sorry, I need to unmute her, just 1 second.
So, okay, so thank you. So yeah, I think based on the experience we had in Indonesia, it does work where we can have or identified persons with disabilities through the ADFP. And it is, yes, it's not only benefited for our as the organization or for the program, but also the benefited for the whole community, which I means including the learning. It's like giving the experience for persons with disabilities also to how to be really involved in this kind or in the response or in the humanitarian context. So yes, it is really it's really good to set up or to build up the network or yeah, to form the ADFP. Thank you. Over to you.
Great, thanks Chuchu for that. Maybe just a follow-up question on that, and that is from Isabel. She's thanking you for the presentation you did, and she was asking, in view of all the barriers you mentioned, so stigma, no parents and family cards and IDE, what would be the factors to make sure a household survey would reflect family members with disabilities? Oops,
Okay, so yeah, from our experience, that's again when I mentioned about the working or form the ADFE, that's one of the thing where those people who joined mostly or almost they know about the households who has a member with disabilities. Another thing is that's working with the very local authority, it is very important to like first of all like giving them the awareness about the importance of including persons with disabilities to receive or to benefit it as the cash recipients. And other things that's also things to consider is that like a providing what the words the right words, it's like it's not exceptional, but it's because of the condition that they don't have those ID cards, but in fact that they are in the situations that's really in at risk, for example, and then needs to receive, and then we'll avoid to left that those community or those person. It is also important to consider about like providing the something like letter of don't know in English, it's something like letter to, statement letter, for example, if that's the right word in English, but like a statement letter that signed by the local authorities, for example, that this person are really a their community member, or let's say in the village member.
Great. Well, thank you so much for that, Chuchu. I see in the chat that extra costs discussions have stimulated some questions too. Manu, if I may pose you the next question. This is from Said Mohammed, and he's asking, I was wondering if we have an impression from needs assessment of disabled people, say 2 to 3% or more, then we can include this in direct costs, like we do it for service charge for financial service providers per beneficiary per transfer. Is this doable? I guess the question also is, once, well, how do you assess the extra costs in a humanitarian context? And once you've assessed it, how do you address those costs in a cash transfer program? Manuel, over to you.
Thank you, Tusha. Maybe I can start off real quick and then hand over to Daniel, who I'm sure can also contribute some on related to ongoing research. So we conducted this one more in-depth survey in Indonesia in one of the cash transfer programs to really assess extra cost in more detail, also using the Washington Group questions to be able to analyze the data based on different types of functional limitations people will have in their daily life. Now, this survey was implemented by a local organization of persons with disabilities who was a partner of CBM. And the data has been quite inconclusive that came out. It was, we recognized how difficult it is for people to estimate their average cost, and how difficult it is for people to differentiate between what they actually spend, which is sometimes extremely little in terms of actual cost for disability, and what they would need to spend to achieve similar levels of basic needs coverage than other people. So people with disabilities, persons with disabilities, often they didn't even imagine, you know, what should I be spending on accessible transport, for example, so I can go to the market to do the shopping myself. So the data has been quite inconclusive. We have tried different methods with focus group discussions, so being more qualitative. where we did get some estimate, and this was in Burkina Faso, and it was also roughly 20%. But again, this is quite, let's say, imprecise because it's based on a consultative process, and we had a similar situation in Bangladesh. Now, we can assume that it's somewhere between 20 and 30%. So this raises the question, how do we integrate this in a regular or large-scale cash program? And our solution so far has been to provide a top-up amount, not to integrate it within the calculation of the actual cash transfer. Maybe Daniel, if you want to add a few words, otherwise I'll hand back to Tusha.
Yeah, sure. I mean, the challenge with the cash transfer is the fact that these costs vary so much. So if you estimate that the average increase is 20 to 30%, if you give everyone 20, 30%, there's going to be people who you are vastly not giving enough, and others people who you are giving more. And I don't know. I've been working on this issue mostly in non-humanitarian settings, where we've done extensive surveys with people, and usually the conclusion coming out of those studies is, oh, we need to provide a suite of programs, of concessions, good services, and cash in order to cover all those costs. But in a humanitarian setting, it really does pose more of a challenge, and especially if you just want to give cash. We do have methodologies that we're developing to try to estimate these costs. We've been doing it in Indonesia and Bangladesh and Kenya, and are about to try to do it also in Georgia. But it does require pretty extensive consultation interviews, not with a lot of people, but to do it on an individual basis, having somebody come in and assess what their extra costs are, I don't think that's really feasible in this kind of situation. So it is a challenge that we need to start thinking more about how to do it in this setting.
Great. Well, thank you, Manu and Daniel, for responding to that. Clearly, it is a debate right now as to how we are going to address these extra costs in a humanitarian context, and what would be an acceptable solution and approach to this. I will move on maybe with one more question, which was around identification but use of tool. Could you, Chuchu, share your experience, or at least share some details on the use of Washington Group questions in cash programming, and what has been the feedback from the field teams who have used this? Oops. Chuchu, can you unmute yourself now?
Yeah.
Yeah.
Okay. Yes. Yeah. So from our experience on that, on using the Washington Group sets of questions, it's a different. Depend on the who are we work. For example, with the recent one, that's for the response in East Nusa Tenggara, there are also that we need to really convince them on how to use the Washington Group questions. But from the previous experience, that's those that I mentioned in the beginning. Well, it can say like it's not that easy one, but it's not that difficult one. It's something like it is like a quite new for people who are working on it, and then we need to provide more on the technical guidance or technical assistance on how to use that. First of all, on the how to translate to very simple bahasa Indonesia, for example, and then to be understood by the enumerator. That is very important. And then having the briefing or induction or kind of short training to enumerators are also very important things, because that's we consider not all enumerators, they are understood or they have the knowledge or experience on working on disability inclusion, which we highlighted of that as well. And then the third thing is also really to work with the partner who are convincing them that using this instrument is really help to ensuring the inclusive or the inclusive targeting, instead of having the, as I mentioned, about the conventional classification based on the impairment. Over to you.
Great. Well, thank you so much, Chuchu, for that. As I said, we're running slightly behind schedule. So Christian, I will hand it over back to you. We still have some questions in the chat that are quite interesting, and will be good to respond back to those questions. Perhaps we can take time and put it through the web link that is going to be published afterwards. Over to you, Christian.
Yes, thank you very much, Tushar. And indeed, so for everyone's information, the idea is to have an outcome paper that comes out from this call, and a Q&A document where we will try as much as possible to answer to most of the questions that have come up in the chat box. So we are now reaching the end of our session, but I would like to then hand over to our two experts that will be doing the closing remarks. So I'm going to hand over first to Karen Pichi, who is currently CALP Director. So Karen, thanks very much for being with us. Over to you.
Right, thanks, Christian. And let me start with a big thank you for inviting me to join you. And you know, it's been really good to listen to everybody, and it was really good to kind of see a draft of the document that you will be publishing. So huge thanks for that. And then a second big thank you actually to CBM for joining CALP and really starting to drive some of us, you know, to raise this up our agenda. So I think this is fantastic, and it's been really interesting. So thanks for the panelists. A few thoughts and a couple of takeaways, and I'll keep it very short. One of the things I love about CASH, and one of the things that inspired me to join CALP, was that CASH is fundamentally about dignity and choice. It's a tool that says, actually, let's shift that power away from the deliverer of aid to the person receiving, and they make the choices about what they want and how they spend resources, and obviously make, you know, much better choices than we do on people's behalf. So as I listen to this conversation, it feels like to me that this is, how do we then make sure, as we're moving along this CASH journey in changing the humanitarian system to use CASH, how do we make sure that we don't genuinely leave anybody behind? And that this should mean dignity and choice for everybody in a humanitarian crisis. Listening to this, I think there were 3 or 4 key takeaways for me that kind of that pulled out. One, there was a comment about there's no perfect distribution system, and absolutely agree. It's a big problem. But one of the things I found with distribution systems in CASH is they're designed for the agency. All too often, it's about what works because it's convenient. And there's very good reasons why that happens. You know, you can get scale, it's simpler and management-wise and so on. But if we ask people, whether they're people with or without disability, what they want, would that be the payment system of choice? So being able to then move that to being able to then say within the choice within disability, is it about one or other, or is it about being able to offer multiple choices of distribution? I think the second point that really struck me was the extra costs of disability. Not just talking about the extra costs of living, which I think most people are conscious of, but to some extent anyway, but the costs of exclusion, the cost of how support structures break down. And when I read the draft report, the importance being linked to connecting people in with existing social safety nets. So that relationship with government support systems as well, so that we're not just providing support in the here and now, we're also helping people connect in to the future to be better supported after the crisis. A third point, as I was listening, was we published last year the State of the World's Cash report, and one of the chapters in there is about quality, and it's about quality by whose standards. So increasingly we're saying, oh yeah, we need to improve the quality of cash, but who's to say what that quality marker is? And at the moment there are no common metrics that are agreed about what quality is. We're touching on issues around efficiency, effectiveness, and some standards across different sectors. But ultimately, the voice of people, the voice of recipients isn't heard enough in that discussion. So quality by the perspective of recipient. And in that, of course, this discussion flags that it needs to be the quality of by the perspective of all recipients. And we need to be listening to all their different considerations. As penultimate point is the question around perceptions. And I think that really comes out, and as we listen to the questions in the needs assessment, there was talk about can I hear, can I speak, and so on. But what about those questions of perceptions? How much are we building those in? And probably it needs to start more at home. Where are the perceptions of the aid workers? Why are we finding it so difficult to change? Often we need to get further into that discussion as well as into the discussions in communities. And finally, I have to say, I love the fact that I'm hearing within this all the examples of collaboration, which is very much the heart and soul of where CALP is about. But I'm hearing collaboration with organisations with differently abled people. I'm hearing collaborations with local governments and with local organisations. So as we go forward on this, I'm really looking forward to collaborating with you all to see how we can raise this further up the agenda within cash globally. Thank you, Christian.
Thank you very much, Karen, and we very generously take that hand that you're offering us to keep collaborating. And actually, you've raised so many good points now in your closing remarks that keep challenging us to find the right ways of meeting the needs and also the rights. I mean, you mentioned dignity. I think dignity goes along with ensuring the rights of affected populations are met. So thanks very much for your comments. And now, finally, I'm handing over to Gordon Rattray, International Program Coordinator at the European Disability Forum. Gordon, over to you.
Thank you very much, Christian, and thank you for the invitation to participate. I will probably start by echoing a little bit of what Karen said in her last statement there. It has been great to hear the progress that has been made. I remember maybe 4 or 5 years ago sitting with colleagues from CBM Global and CALP having an exploratory discussion about the potential of cash delivery as a modality in humanitarian aid and how it could be done and what would be the advantages. And I remember at that moment having the immediate realization that this has got potential to be a big game changer in this field. And as Karen said, it's about choice, autonomy, independence, dignity, and these are things that persons with disabilities are struggling with, battling with on a daily basis, even outside of humanitarian crises. So when we have a modality that addresses these things, then we're going a long way to improving the quality of life of people with disabilities in crisis situations. And of course, practically speaking, as was touched on during some of the presentations, people with disabilities are already heads of households. They're already earning incomes and they're already budgeting for their families and dealing with money. So the concept or the assumption that I know exists that they would somehow innately be incapable of dealing with money and using it responsibly obviously has absolutely no basis. Access to cash is going to make them be able to lift themselves more quickly and more efficiently out of poverty during crisis and in crisis situations. I also maybe identified 4 or 5 key things which I will quickly list, maybe more as concrete priorities from the presentations that were given. So the first one was that it's essential to understand the population and the barriers that they face. And you spent some time going into the importance of disaggregation of data by disability, using the recognized methodologies like the Washington Group questions, and not forgetting to identify the extra costs that persons with disabilities face on a daily basis to participate equally in society. And using the answers to the Washington Group questions to identify the barriers and to remove these barriers, all sorts of barriers to communication, physical barriers, etc. And all of this, of course, since we're talking about cash, requires dedicated budget. And this is often a scary point when it comes to donors and to humanitarian actors, NGOs, international NGOs. How much will it cost? And my answer is, it's not a cost, it's an investment. If you're doing it now, it will make it cheaper in the future. And in the long term, it's going to make it more efficient and cheaper for everyone involved. So those were 4 quick points. My last point I wanted to dive a little bit deeper into, which I'll just take a minute, is about the meaningful participation of persons with disabilities and their representative organizations, so OPDs or DPOs. And I would say that this has to be not only at the monitoring and evaluation and assessment stages, but most crucially at the preparedness step. So even now, before a crisis happens, make partnerships, meaningful partnerships where the power balance is as equal as possible with DPOs, so that you're prepared for when the crisis happens. And this might involve, DPOs are people with disabilities, and DPOs are busy people. They're already full-time doing all sorts of other work. So they may not have the time to just suddenly jump into this. So it's also a case of asking them, do you need training? Do you need financial support? And if yes, make sure the financial support is somehow going to strengthen their governance systems on the longer term beyond the time scale of the project. So making sure that they've got the human resources to be able to engage now, but also that those resources stay in place for the future. And finally, I would just finish by saying that people with disabilities basically have the same requirements as everybody else in society. So, plus the extra costs in some situations. So it's a case of mainstreaming things as much as possible. Use the processes that already exist to embed people with disabilities and their requirements into those processes, while addressing the specific requirements that they might have because of disability and the barriers they face. For me, scaled up cash transfer programming is undoubtedly going to make a huge difference moving forward, providing autonomy and independence for people with disabilities. And I'm looking forward to seeing this space develop further. So thank you again.
Thank you very much, Gordon. So I won't say any more on top of what you and Karen have said. I think those are very good closing remarks, and you've both touched on so many important points that I hope it makes people keep reflecting and trying to make sure all these considerations in cash programming. So we've just reached the time. As I said earlier, we will be providing the recording of this session, as well as an outcome paper and PowerPoint presentations, which we will be uploading in our CBM Global website for all of you to access. And please feel free to reach out to us as well in case you want to discuss further. So thanks very much to all participants for joining. Thanks very much for HNPW, Isabel, and all the organizers for this opportunity. Thank you very much. Bye-bye.